There are so many types of birth control available. When the pill first came out in the 1950s, the options were very limited for women, and they were limited to mainly married women. Now birth control is not only available for use as birth control, but a lot of younger women use it for help with painful periods, heavy periods, cramps, also with acne. So there are many types of birth control available. There's a birth control pill, and there are many different formulations, all the way from 35 micrograms of estrogen all the way down to 10 micrograms of estrogen. There are IUDs, which are intrauterine devices. There are two commercially available IUDs. One lasts for 5 years, that's Mirena. The other one lasts for 10 years, that's Paragard. There's a birth control ring, and that has 20 micrograms of estrogen. It's called NuvaRing. There's a birth control patch that's called the OrthoEvra patch. There's Implanon, which is a 3-year implantable birth control. And of course, there are some more permanent forms of birth control, like the Adiana, which is a surgical implant. And then there's Essure, which is also a surgical implant. And then there are some forms of permanent birth control that can be done laparoscopically. Probably the main risk associated with taking birth control is the risk of venous thromboembolism, or blood clots. And when we talk about blood clots, we mean blood clots in the lungs or the legs. Those can be life-threatening blood clots. They're usually limited to just a certain population of patients that may be high risk already, usually smokers that are older than 35, any women that may have a family history of thrombotic disorders, but mainly the general population is not at any increased risk for forming clots in their lungs or in their legs from taking birth control.